of new COVID-19 cases recorded across the region. The region, as of June 2021, recorded a total of 1,456 cumulative COVID-19 cases with a case fatality rate of 1.74%. Regional Health Director Dr. Fred Adumaku-Boateng disclosed to Joy News that the region had recorded a total of 77 new cases over the past 2 weeks, a situation he described as worrying.
The first wave, we got 788, and the second wave, we are having 745. But the reason why we are having this interaction is that for the past 2 weeks, we had gotten a total of 77 cases after kind of a virtual silence. So if we know the total number of deaths are 27, the first wave there were 14 deaths, and the second wave there are 13 deaths. So the total case fatality rate that we have recorded in Bono East is 1.7, and this is way above the national figure of 0.6. So this is what we have at Bono East. In terms of where the cases are actually coming from, we have about 31 of them coming from Bono East, and then 16 of them coming from Nkranza South, 10 of them coming from Tintampo North, and then 20 from Techiman Municipal.
The increase in the number of cases across the region, according to Dr. Fred Adumaku-Boateng, is as a result of the neglect to safety COVID-19 protocols.
One thing that we have recognized is that people are they are done with the hand hygiene. People really don't use the alcohol anymore. But you can be wearing your mask, but you can infect yourself if you don't really practice good hygiene. So we are intrigued that we still continue and go back to the hand hygiene. People are even started hugging, shaking hands, and they are done away with all the other protocols that we are supposed to. So we should go back and then adhere to the protocols.
He added that about 34% of the total cases recorded are health workers, and this is because health workers do not adhere to the basic standard precautions of COVID-19 protocols.
And then our health workers are still having infection. So, we have a total number of almost about 500 of these cases being health workers, putting the percentage to about 34%. But we still have a challenge with our staff adhering to the basic standard precautions.
Authorities in the region are, however, putting in measures to help contain the situation. Key amongst them is the region's decision to ensure that all hospitals across the region manage positive COVID cases.
Bono East, every facility that manage or admit cases, we are managing moderate cases of COVID. We only refer COVID when it's critical and refer it to a facility that has been mandated to manage severe. Every hospital, private, and public, is managing COVID-19. We have communicated that they make sure they have dedicated at least 10 beds to manage the cases.
Reporting for Joy News, Anas Sabit, Techiman.
The COVID-19 task force, which I chair, has recommended that a second look be taken at the protocols that have been put in place for social and public gatherings, in particular weddings and funerals across the country. I have in previous updates emphasized the need for the strict observance of safety protocols at all such gatherings. To ensure that such gatherings do not become the sources of infections, the following must be adhered to by all at these gatherings. Firstly, the wearing of masks continues to be mandatory, and persons must respect the enhanced hygiene protocols. Secondly, all such events must be held in open-air spaces. Thirdly, the duration of such events is limited to 2 hours. Fourthly, there must be observance of the 1 meter social distancing rule. And fifthly, handshakes must be avoided. Furthermore, given that people sitting together to eat, drink, laugh, dance, and talk in large gatherings without masks are the riskiest activities for spreading the virus, all post-event receptions, particularly related to weddings and funerals, are banned. I want to reiterate the protocols surrounding activities in churches and mosques remain the same as our protocols in schools. With workplaces currently witnessing a resurgence in COVID-19 infections, it is important that owners and management of businesses and workplaces implement strictly the guidelines on staff management and workplace protocols, such as the use of a shift system and technology, mask wearing, social distancing and hygiene protocols, as was required in the earlier days of the pandemic.
And you heard President Akufo-Addo as he spoke to the nation yesterday in his 26th address. We heard earlier, though, from Dr. Fred Adomako-Boateng, Director of Health, the Bono East Region. He is joining me for a conversation on the back of all the revelation. Doc, a very good morning to you, if you can hear me.
Good morning.
Great. Thank you so much for your time. So 77 cases in 2 weeks. How have you been managing the 77 cases?
Yeah, to just give you a further update, we are now talking about 109 cases now. So you can just see, just within a week, the number of cases that we have gotten from Bono East. The good news for us is that most of the cases are still mild cases. And virtually, we are managing all of them with the home management. So that is the story for Bono East. But you see, as the discussion has been going on, we still are not out of the woods. Virtually in June, we were recording only like 4 cases a week. And just within a space of 3 weeks, we have 109 cases. Then it speaks volume. And that's what we will say. But I just want people to understand that when we say there is an outbreak, unless the outbreak is declared over, all the measures that we have in place should be strictly adhered to, because the potential for this disease to spread, in fact, we don't know where we are still going to end, if you ask me, because it's still evolving and then we don't know much about it. In as much as we are also putting in preventive measures to make sure that we stop the spread, the virus is also evolving. So if you realize, if you compare the first, second, third wave, anytime you have another wave, the rate of spread is so high as compared to the previous one. And so we should also have that in mind that, look, whatever mechanisms that we have in place, at no point should we relax in any of them. Because and I'm not a prophet of doom, we are going to have a series of these waves until finally we come to the end. I mean, we should learn lessons from this. And we should also know that anytime we put in stringent measures, especially the hand hygiene and the wearing of masks, how come we are always able to slow it down?
Yeah.
So the problem really is our behavior. And we are most of the time causing the spread of, if you bear with me, most of the time the cases or the case come in one. We had only 1 or 2, but because of our behavior, you see it's like wildfire, then it is going on. If you go around Bono East, most of our places, you still see people not even in face masks. At times when I enter my office and they see me,
and they now put it on. So the understanding has not really gotten to us for us to see that, look, until the pandemic is declared over, at any point in time, we should still abide by the stringent measures, because that is our best bet.
Thank you for sharing those, though. But the 109 cases that you have, do you know if it's the Delta variant or a variant that is not so alarming as the Delta?
So we normally infer, the moment, if you see the first wave that came, the Wuhan, and the whole world kind of got it. Okay, then we had the UK strain and the South African, and the UK strain became the dominant one across the world. And then we had the India one. So we kind of had been having virtually silence for all these cases till the inception of Delta. So the moment you bring it, it means that we have been able to curtail it. And then suddenly there is an explosion. Obviously, it means something is happening. And with the data that we have across the country, you can definitely infer. I can give you a typical example of one of the scenarios that we had. 3 of the cases that were confirmed positive, we had 9 of their contacts being positive. So within this cluster, about 12 of them were having. And then if you look at the nature of the cases, it follows the trajectory of what Delta is doing. Like it comes in cluster, in areas where people are, because the spread and infectivity is so high that if you are not careful, so you see it over, if you come to Bono East, the cases are clustered at Bono East, Pro East, Stetiman, South, and Kranza. So you can see the cluster of where the cases are. So we can definitely infer that it's likely to be Delta variant, which is causing this.
How about, are any of them fully vaccinated, or have they had a first jab at least?
Yeah, so if you have the cases that we have looked at, especially the health workers, half of them were vaccinated, at least have gotten their first one. Half of them have not gotten the first one. So basically it's 50-50 over there. But we understand that once you are vaccinated, even if you have the breakthrough, the severity is not as much as compared to an unvaccinated people. But the question that I would want to ask is that if you look at the greater Accra, you look at Ashanti region, basically I think the vulnerable groups have been vaccinated, even given their second dose, but it's still the hotspots. It's trying to tell us something that within the remit of all these, there are things that we should still continue doing. Look at UK. They are also having a challenge, but virtually majority of them have gotten even their second vaccination. Look at US now that they are also having a challenge. So vaccination is good, but we still have to make sure that the basics, the standard precautions that we are supposed to do, i.e. the face mask and the hand hygiene. My problem is a lot of people are even infecting themselves with a face mask by not using the alcohol as it's supposed to be used. So we can infer that, looking at the trajectory, it's likely to be the Delta which is causing it, but actually samples have been taken and they are in the genomic sequence.
I'm curious though, because a lot of the cases that you have are health workers, and you are supposed to have the tools to protect yourselves. So you can have people, coming in with positive cases, but you shouldn't be as affected, should you, if you are also adhering to the protocols?
So we did, Bono East decided to do a quick study, actually, when we saw our health workers are being infected. So we have done a study with Kintampo Health Research Center, and then we are ready to share the results with other people. But it's amazed us when we looked at the results. We realized that when health workers are exposed to people that they think are having COVID, they put in all the standard precautions. But when health workers are exposed to other people that in their minds, they are not likely to have COVID, they lose their guard. So basic standard precautions that they are supposed to undertake whenever they meet a patient, that is where the problem is coming from. So for us, we've been able to see that, look, the standard precautions should always be adhered to, irrespective of your knowledge about the patient sitting in front of you. And that is the challenge for us. That, look, that is the gap in terms of the standard precaution, your wearing of your mask, using your hand hygiene, your 5 movements, anytime that you are supposed to make sure you sanitize your hand. That is the challenge for us in the health setting. The study we just did, we realized that the logistics were available. The alcohol, all these were available. So, but we realized that the people who really were having the case as compared to those who didn't adhere to the basic standard precautions that we're having.
Okay. Doc, stay with me because I want to come to the leg of enforcement. But let me welcome to the conversation Professor Alfred Yorson. He's head community health at the UGMC. Prof, a very good morning to you. Suddenly, we are all beginning to talk about this matter again because of where we find ourselves today. Talk to us about, Noguchi has issued a statement, warning about the Delta variant and how it spreads and the cases that they're beginning to record. Talk to us about how this is different from the ones that we've known.
Okay, thank you very much, and thank you to my colleague, Dr. Adumakun, for educating the public this morning. The Delta variant, as we've come to know, is quite easily transmissible, and it induces a lot of replication in the human, and therefore, as we see, the number of viruses, if we can say it that way, that you can count in somebody who is infected is relatively higher than what we have seen. And once the person harbors a lot of the viruses in the system, then it is much more easier for this one to be transferred from one person to the other. And again, it would then be much more easier relatively for this virus to cause symptoms, signs, and cause the person to have more severe disease than we have previously known. And usually that's how the organism behave. They behave in ways that will make them be able to affect so many people, so they ensure their survival as well. So when we have variants, then we need to ensure and know that we put in measures to reduce their ability to move from person to person. And that is what the Delta variant is exhibiting now.
A bit of the emphasis from the president's speech yesterday was on funerals and weddings. But we know that there were restrictions already in place, except that, majority of the people, including those in leadership, simply refused to do the right thing. And I want to come to the issue of enforcement. Do you, from where you sit, because yours is community health, will people respect this?
Yeah, so we need to continue to encourage Ghanaians, individuals, and at the community level to take their destiny in their own hands. At the end of the day, our leaders can do as much, and they may falter along the way. But we cannot use that and say that because A and B happen, we are not going to abide by the principles or what we need to do to protect ourselves. I think it is high time we stop that and put all our shoulders to the wheel and see that we are all in the fight together.
But how do we change mindsets? How do we change mindsets within communities? I mean, if you go to workplaces, you find that maybe a majority of the people are abiding because of because it's a corporate environment, if you like. If you go to the market, they are simply not adhering. And it's been like that for a long time. Now it's gotten worse. If you go to communities where you live, you'd find that majority of the people are simply not bothered.
Yes, certainly, because it fits into the general picture of we letting our guards down and thinking all is well. All is not well. So one, we need to step up the public education in the communities at the lower levels using the health information system and the health care system, as Dr. Adumako indicated. And also, we always encourage the use of what we call community-based organizations, Queen Mothers Group, Market Women Group. If the chief of the market chief, insists that if you don't wear masks, you can't sell in my market, believe you me, these are very powerful and strong structures we can use. So we need to encourage these local systems that we have. The chiefs, the Jasi chair, the man chair, all those people at the local level have some level of authority, and we need to solicit their support in this regard, while the health system and the information ministry tries to do the former things. We need to go down our religious leaders, traditional leaders. We need their support at this time. If they live by example, by and large, many of the people in the communities will follow their example. And above all, we ensure enforcement. In public health, if all else fails, legislation, getting people to face the sanction as it were. Again, if we want the sanctions to be ensured, what we will encourage is that if, for example, police is ensuring and getting people to clean, do other things, at the end of the day, they should be able to provide them with masks. That is the essence. So you don't just punish the person and let the person go spreading it. We should be able to support them with masks. So after getting you to do what you have to do because you are not wearing masks, we give you a mask that wear it and go and sin no more. As we say, these are measures that we can easily put in the community to get people to comply. So we need to, much as we need to ensure sanction, we also need to provide an enabling environment for people to be able to comply. And I think we should look at that seriously.
The difficulty, though, is that some of the enforcers themselves are not even adhering to the protocols. But let me go to Dr. Adumako Boateng, because I wanted to talk to you about enforcement. What are some of the strategies that you're putting in place in Bono East, to be specific? Hello, Dr. Adumako Boateng, are you still with me?
Yes, I need to repeat.
I wanted to know about, because we're talking about enforcement, I want to know how you intend changing either the mindsets of people or how you intend enforcing these protocols that has been re-emphasized by the president.
Thank you. You know, the Ebola, I went to Liberia and Sierra Leone, and I engaged the people. The then leader of the delegation was the UNICEF, and he made a very strong statement. He said, "Dog, we were able to handle Ebola when the community leaders, the traditional leaders, decided to lead the fight. When they saw the transmission and how to break transmission, this is how we overcame Ebola. Health is generated by the population, is by the leaders. And until we see that, and see that the religious leaders, the traditional leaders, the opinion leaders within the communities where we live will champion this cause, then we have a long way to go. Because you see, at the end of the day, what the drivers of this deeply are rooted in our cultural, social, and traditional lifestyle. So that if the leaders of these will come to that point to accept that, look, we have to lead this fight. We have won the fight. Can you imagine the chief in the community make a declaration that everybody is wearing masks, wherever you are going, you are supposed to be in having your hand hygiene? It's powerful than any. So they have to really come on board. The Islamic, the Christian, traditional leaders. And for us to understand, I always ask myself, as we engage in this discussion, the common people who are now at Makola sorry for me to say, KGTR, other people, are they privy to the discussions that we are having now? And how do they get to know the importance of all these? Mind you, if you really have the understanding, the cooperation is higher. And until it gets down there, for these people who generate help to really grasp, we have along, how do we engage our traditional leaders? For us, it's the chiefs who really are leading this. And the traditional leaders, so we have to let them lead it. They will have to run with it, because at the end of the day, it's the community that is going to help us overcome this. And as I said, they are not out of the wood yet. It will be going in circles until the virus actually is burnt out, or we have been able to vaccinate a higher majority of the global world, because COVID anyway is COVID everywhere, irrespective of the number. So we will have to get to them. We will have to have a strategy to let the communities, the common people pick it up and say, because the things that we are asking, to me, it sounds simple, but they are not difficult if people really to understand. Because for us to have our lives back, these are things that we do.
Yeah.
Mind you,
but Dr. Adumaku Boateng, if you can hear me, Dr. Adumaku Boateng, if you can hear me, I want to specifically know the strategy that you're putting in place in the Bono East region. These things that you're telling us about, involvement of traditional people and religious grouping, is that something that you're doing in your own region? Yes.
Whenever we are having meeting, it's chaired by the president of the Bono East House of Chiefs. So, it's led by the minister. In fact, last week, we had on Friday, the minister is going to have a meeting with all the RCC so that we will have to discuss this issue. And then he is also going to instruct the district together with the district health team to do. Okay. That is one thing that we. So
I asked this because I wanted to measure the impact of
what we are doing as a.
No, I just wanted to measure the impact that these collaborations have been. If indeed there is some sort of collaboration, then why aren't we seeing the results? But we are rather seeing cases going up.
It is still behavioral issues, and it's not an event; it's a process. So we.
Oh, it looks like the connection has just gone a little bad. We will get Dr. Fred Adumaku Boateng back on the line. But let me go to Professor Alfred Yorsing. He's head of community health at the University of Ghana Medical School. Prof, let's talk about enforcement now. How do we, because there were a number of people, like a constituency that didn't believe in this whole virus thing. And then we went to sleep for a long time. We're now back awake. How do we change the narrative?
Yes, that in terms of the community and public level has been the challenge. As I always say, initially it was stigma. Then we were able to deal with the stigma, and now the persistence of the denial of the existence of the disease, even in the face of rising numbers and increased mortality within the space of 2-3 weeks. We need to continue the education as we are doing, and using the media as you are doing, and also other local language stations. So we continue to engage, we continue to probably get people who have been through the condition to continue to talk. As Fred said, it is a process. We continually need to. We started talking about family planning several years ago. We still have challenges with that. So it is not something that we can achieve in a matter of days. Because of that, we do not have to stop. We need to continue increasing the effort day in, day out. It is not going to be easy or rosy, and also legislations alone will not help. We need to encourage people to see it as part of their daily routines that they go through. Even though wearing masks is uncomfortable, for the sake of yourself and that of your family and others, we need to self-sacrifice in matters of this nature. And that is the appeal we need to get the public to understand, that the disease does not discriminate between the rich and the poor and the person living in Accra and elsewhere. We are all in this together, and as we say, COVID somewhere is COVID everywhere in the country. So it is a process, and all agencies whose responsibility it is to get this information to the public should be encouraged to do more. If it is support, budgetary support, financial support, logistics, we need to encourage these agencies to be at their optimum in this phase. We've done so well for ourselves, and we shouldn't allow this third wave to undo all the good things we've done. And believe you me, as we say, if Ghanaians start wearing the masks and doing the hand sanitizing and washing their hands, you will see that in the next few weeks, things will get better. That is all we need. No matter the variants that we are having, it is always going to be the basic principles of prevention. Wearing the mask, maintaining social distances, and avoiding the mass gathering, especially in the funerals and all that. In the past few months, it's as if no legislations or no ban is on these things, and people do this with careless abandon. And we can't go on like that. So these big events, yes, we need to stop them. And that one, they are easy to stop. And also at the individual level, we need to continue to educate, encourage, and then enforce when it's needed.
Prof,
so that is what we need to do.
Absolutely. Prof, thank you so much for your time. Let me wrap up with you, Dr. Adomako Boateng, if you're still with me and if you can hear me. Just finally, I want to touch on your health facilities in the Bono East region. Hopefully they are not overwhelmed. Can you tell us or paint the picture in terms of how it looks like?
Okay, so we are not so blessed like Greater Accra and Ashanti region, but we are making to do what we have. We have decided.
Dr. Boateng, I can hear you. If it's not the network that's gone bad, okay. Unfortunately, I think the network will not help us continue this conversation. But we're just at the tail end, wrapping up this conversation. Just the last bit about how the Bono East, the health facilities are coping with this over 100 cases that they've recorded so far. Thankfully, I think at the beginning of his presentation, he did indicate that the cases are being home managed. So the hope really is that the facilities will not be overwhelmed. Dr. Fred Adomako Boateng, Director of Health, Bono East Region, joining us on this conversation. Also, Professor Yorsing is the head of community health at the University of Ghana Medical School. He also joined in this conversation. Well, we can only keep reminding you that COVID is real, still very much with us. Look at me, I'm sitting alone here, but wearing my mask because I share the space with some others. You've got to take the precautions seriously. It is your health, and so you must be responsible for it. When we come back, we're talking about the LGBTQI. Where are we with that debate? And the reactions so far greeting this proposed bill, which really formally is not in Parliament, even though there's been a presentation to the Speaker. I'll be speaking to Reverend Dr. Kwabena Oponing Frimpong. That's coming up ahead on the show. Stay with us.